I'm up here trying to problem solve and figure these things out because you may have heard my example earlier when I was standing in my local pharmacy and they were under the impression, DEA witness testified that that was incorrect, that it wasn't, there is no quota, and you've said that as well.
That's right.
But the distributors have to watch it and be careful, and they don't really know when it is they're going to get in trouble with the DEA.
Correct.
So here's what I've come up with that may be affecting, and I represent a fairly rural district that has a lot of small pharmacies. We have fewer mom and pop pharmacies than we used to, but still serve a fairly rural, somewhat suburban, but fairly rural community. And that is that apparently it may be true that at some of the smaller pharmacies, they only use one distributor. Has that been your experience, that maybe some of the small pharmacies use one distributor for their drugs?
You know, I think that will depend upon the where and the when. I mean, I would say, and this is just anecdotal, that is probably true the more rural that it is. More than likely it's one wholesaler involved. But that being said, there is a growing secondary and tertiary industry. When pharmacy cannot get product, they go into those markets to get that product. So it very well may be that they are actually dealing with other wholesalers or may not be reporting data to the DEA. It's very possible.
Well, and the concern that I have is that maybe they're being flagged and the distributor is saying, okay, we can't send you any more because you're getting more than the distributor, you know, next valley over or down the road, depending on the size of the pharmacy. And if you're only using one, that's going to flag. As you said, the DEA gets the whole picture, but each distributor only sees what they're doing.
Correct.
And so they could see a pharmacist perhaps that's using one wholesaler or distributor getting more drugs than some of his contemporaries nearby, but they may be using two distributors, but the first distributor is never going to know that they're getting two sources or three sources versus just the one.
Well, the layer of complexity to that is, and it depends upon the demographics of that pharmacy and the patient population. Because the pharmacy in your district may have historically a number of pain patients. They may be near pain clinics. They may be hospitals or cancer clinics. And so it does vary. This is a difficult target because it does vary by pharmacy, by location, by demographics of the pharmacy, by the business model, where it is relative to other healthcare delivery systems in the area. So it's not as black and white as you might think, and that's where any amount of clarity we can get from the DEA as a wholesaler will be of extraordinary help.
And so that's why you feel that they ought to share some of that information so that you all can get the big picture too. Not that we want to help the bad guys.
That's right.
And so you think that perhaps the information sharing visioned or that's envisioned by 4069 would be a good thing?
I think it would be an excellent thing.
And you think that this might help my pharmacy back home?
I think it would help your pharmacy back home because whatever that wholesaler, whoever it was, made that decision, made it because they know their historical purchasing and delivering with that with that pharmacy, and they probably saw an uptick, depending upon the time of the year or whatever. And the way it's played now is if there's an uptick, then that is defined in the wholesaler's mind, that's suspicious. And then the immediate reaction is if it is suspicious, you must terminate. And then talk with the appropriate people. So the decision always is to terminate first when in doubt.
Now, in this case, they didn't apparently terminate long term. Is that what the normal is? Because
Well,
they just said, okay, no more this month or for this cycle.
Well, good point. It should be for a finite set of time. In fact, we submitted a series of questions on 2 occasions to DEA in the last 24 months, do not have answers to those questions. One of them actually addressed that issue. For example, we asked, as our group of our members said, is 90 days, is 120 days, what is the appropriate amount of time before wholesalers should reinstitute sales to that? What is the appropriate move on the trend line of the purchase order of that pharmacy to make that decision? Unfortunately, to this date, we have no answers. We've got no guidance from the agency.
Well, and it's a difficult answer, and so certainly don't want to be critical of the DEA trying to control medications that shouldn't be out there on the street and making sure that they're not going to folks who shouldn't have them. At the same time, we want to make sure that the judge's wife that I mentioned earlier and that this lady whose mother desperately needed that medication are able to get it. So it's a balancing act. I appreciate that. And, of course, being a legislator by nature and at heart, having served here not so long but served a long time in Virginia, I recognize that it is the role of the legislative body to help enact that and move things forward. So I hope that we can get some form of 4069 passed. And, Mr. Chairman, I yield back.
Chair, thanks to gentlemen, and also thanks to witnesses for your testimony, for answering our questions. There will be